Today let us know about hydriatic management of bronchial asthma. Here there are two distinct terms, one is hydrotherapy, the other one is bronchial asthma. So let us know about the hydrotherapy first. What is hydrotherapy? Hydrotherapy is a treatment modality using water in different states, forms, volume, pressure and temperature for a definite period of time to attain a desired effect. So what are all the different states? Obviously it is solid, liquid and gas. So we use ice, water and gas. What are the different forms of hydriatic treatments? We have learned that there are different forms like baths, compresses, irrigations, poultices, etc. Coming to the volume, it is the quantity of the water which is being used. So if you are applying all over the body, large quantity of the water is used. So it is for the general application. So small quantity of the water is used for local application. The pressure in the hydrotherapy can also be different, and it is because of the air column which is being mixed with the water column, and along with that there will be water is made to pass through a small nozzle. That is why the pressure which could be applied can be high or low. So there are high pressurized applications and low pressurized applications. So hydrotherapy can also be given in different temperatures like cold, neutral and hot. Cold is 18 to 24 degrees centigrade, neutral is 24 to 26 degrees centigrade and hot is 36 to 40 degrees centigrade. The duration can also be varied. So according to the duration, the effect can also be varied. So duration can be short, moderate and prolonged. So coming to bronchial asthma, what is bronchial asthma? It is a chronic inflammatory disorder causing recurrent episodes of wheezing, breathlessness, chest tightness and coughing, particularly at night or early in the morning due to airflow obstruction, and usually it is reversible, and this airflow obstruction is because of the blockage in the airways due to hypersensitivity of the bronchial mucosa for various stimuli. Because of this bronchial asthma, there could be limitations in the daily activities, loss of work days, lower quality of the life. Coming to the pathogenesis of the bronchial asthma, there will be early bronchospastic response, then this early bronchospastic response will change to late bronchospastic reaction. All these together, early and late bronchospastic response and reaction will result in chronic asthma. So in chronic asthma, there will be destruction of the airway epithelium due to toxic granule contents and epithelial shedding into the bronchial lumen, then exposure of sensory nerve endings and imbalance in the neuronal control, resulting in airway remodeling with subendothelial fibrosis, goblet cell hyperplasia, smooth muscle hypertrophy and vascular changes. Thereby there will be fixed airway obstruction. What are all the asthma triggers? How asthma occurs? Maybe because of the allergens like dust mites, mild spores, animal dander, cockroaches, pollen, indoor and outdoor pollutants, irritants like smoke, perfumes, cleaning agents, then pharmacological agents like beta blockers, physical triggers like exercise, cold air, physiological factors like stress, then diseases like GERD, gastroesophageal regurgitation disease, or it could be upper respiratory infection, or it could be allergic rhinitis also. So because of these triggering factors, there will be airway inflammation resulting in more mucus production, airway muscle tightening and swelling in the bronchial membrane. Because of these, there will be narrowing of the breathing passages resulting in wheezing and cough. So clinical feature, obviously as I already told you, it will be cough, wheezing, dyspnea, chest tightness along with the history of allergy and respiratory distress. So depending upon the clinical feature, we can classify the asthma into mild, moderate and severe. See, mild is usually intermittent asthma. So there will be less than 2 episodes of asthma in a week. In night times almost there is no much disturbance in the sleep, but still it could be less than 2 times in a month. For the moderate or persistent asthma, the daytime symptoms could be more than 2 per week, but less than 1 per day. In night times it could be 4 times, the symptoms can occur 4 times in a month. In severe or persistent asthma, in daytime almost it is continuous and it is at least 1 time asthma attack per day. In night time also there may be more frequency. So, depending upon the clinical features, we can have mild, moderate and severe asthma, or else we can just say episodic and chronic asthma, where in episodic there will be symptom free period and in chronic asthma there will be mild, moderate, severe with superimposed acute exacerbations. Now, coming to the hydriatic management, how do you connect the hydrotherapy treatment and asthma? How do you treat asthma? So, before going to the treatment as such, we need to know about the goals of the asthma treatment. So, it is to control the chronic and nocturnal symptoms, removing the mucosal plaques, releasing bronchial constriction, reducing inflammatory activities by decreasing the hypersensitivity of the bronchial mucosa and nasal mucosa, maintaining normal activity, physical activity including exercise and cold exposure, strengthening accessory muscles of respiration, preventing acute episodes of asthma by giving some hydriatic treatments, then maintaining near normal pulmonary function. How do we achieve this? It is by hot and cold applications. So, before going to the hot or cold application, we need to know the primary effects of hot and cold and secondary effects of hot and cold. In primary hot application, when hot application is made, there will be peripheral vasodilatation, increased capillary permeability, increased oxygen consumption, increased local metabolism, increased blood flow, lymph flow and increased motility of the leukocytes. The primary effect of cold application is peripheral vasoconstriction, decreased capillary permeability, decreased oxygen consumption, decreased local metabolism, decreased blood flow and decreased lymph flow with the decreased motility of leukocytes. So, primarily there is increased metabolic activity in hot application and in cold application there will be decreased metabolic activity. Coming to the secondary effect of hot and cold, the cold becomes active or it stimulates the body action. So, the secondary effect of the cold will be tonic, whereas in hot application, even though it is stimulant at the beginning, after some time, that is as a secondary effect, it will be having depressant effect on the body. So, after knowing primary and secondary effects of the body, we can plan for the hydriatic management of the asthma. So, we will know about different applications in different forms, different temperatures, how the asthma could be managed by the hydrotherapy in the next class.